We've been living with hotel quarantine over here for over a year. I think here and abroad, hotel quarantine means a lot of different things to a lot of different people. There are people who look at the police outside the hotels and they have real ideological problems with that, a real ideological opposition to that. You see some of the pictures there on the left as you're looking at it of some of the people in our hotel quarantine who are out on their balconies watching a musical performance, which is one of the strategies we've had to sort of take away the boredom. And some of these people think hotel quarantine's been okay, and they've been very happy to do it, in the name of sort of controlling the virus. And then down the bottom of this slide, you have the headlines, the hotel hell sort of things that the media enjoy, the terrible food, all these kind of things, and I suppose the point I'm making is that hotel quarantine means different things to different people, and lots of people have different perceptions of it and different real experiences of it. And I think all of us would agree that hotel quarantine is a bad thing to have to do. Like, it's not pleasant at all, but it's all just part of that risk benefit analysis, isn't it? You're doing a bad thing to really give us in Australia the quality of life that we have at the minute, where I can go to a cinema or a bar or a restaurant, and in my non-work day I don't have to think about COVID very much. But I suppose the reality here is, in my next slide, and I think you can see my slides okay, is what we do, I suppose, in the practical sense. And it's not that different to Ireland, outside of, I suppose, how comprehensive we are about it. And in Australia, before you get here, you've got to apply for permission to come into the country, because there's only a certain amount of hotel quarantine rooms, and we have to sort of align airline arrivals with the number of rooms that we have. But the process is broadly similar to what you've got back home. You get off the plane, you get in a bus, you go to your hotel, a legally binding quarantine order is issued to you, and you go to your room and you're there for the next 14 days. You get tested at the beginning, sort of day 1 or day 2, and you get tested at the end. Interestingly here, if you test positive for COVID, you go to hospital to be managed there, even if you've no symptoms whatsoever. And that's just a way of, I suppose the thinking is, in hospitals, we have negative pressure rooms, we have staff who are, very well trained in infection prevention and control. And so, there's less chance of a leak out of a hospital environment into the community, because that's really been the source of all of our COVID since we got through our first peak. It's all been leaks from hotel quarantine or leaks from hospitals. So so that's really our process. And we've had about 250,000 people through, and somewhere in the region of about 1,500 to nearly 2,000, probably about 1,800 at this stage, have tested positive. And we're a zero COVID environment, and I think we could all agree that 1,800 cases being sort of let into the community would, with the exponential growth that we see, would have resulted in us being as hard hit as anywhere else. I think one of the key issues here is we have a sensible exemptions process, and I'm happy to take questions on that if people are interested. But I think part of the planning for this is that we established an exemptions unit for the whole COVID piece, not just for the hotel quarantine bit. But for example, I see a lot of headlines at the moment from Ireland about people, sort of for, really humanitarian reasons, looking for exemptions or looking to have a different form of quarantine applied. And we have a unit established in each state for that, that's really staffed by legal people and medical people who will work out, will talk to each other, and will talk to their local public health units about these really difficult cases and make sensible plans for these people, so that we can do this. We can apply what's really a very difficult sort of intervention in as humanitarian way as is possible, though that's difficult broadly. Look, I think an important point to make is that people get very evangelical about interventions, whether it's hotel quarantine, masks, ventilation, antigen testing, whatever you're having yourself. They're all part of a package, and I don't think you can suppress this virus to any manageable way without hotel quarantine. But having hotel quarantine won't mean automatically that you can suppress the virus. And I suppose, look, these two slides are just pictures of things that I think are just examples of things that happen well in Australia that don't happen well in Ireland. Ireland's broader public health response is, internationally maybe not as good as other countries. And the picture on the left is a fever clinic. And I suppose we take the view that hotel quarantine is about keeping cases out of the country, so that the cases that are here, we can go ahead and hammer and really snuff out those transmission chains. But to do that, you have to sort of aggressively find cases. So we've taken the approach right from the start that you can just turn up 7 days a week to what we call a fever clinic for any reason you want and get swabbed for COVID and have a result the next day. That's one example of the type of things that you have to do alongside hotel quarantine. And the other slide on the right is one of our public health teams, a happy, well-resourced bunch. The public health units in Ireland are on their knees and were so before the pandemic. And you can't get a public health doctor in Ireland for love nor money because they get treated so badly. And Ireland hasn't hired a single consultant in public health medicine. So I suppose the point I'm making is look at hotel quarantine in its place. It's really, really important, but it's part of a broader suite of public health measures. This is the quickest slide I've ever had. Who goes into quarantine here? Everyone, except New Zealand. So we've established a travel bubble with them. And ultimately the aim would be, as countries get to sort of very, very low levels of COVID, to hopefully establish some more travel bubbles. And some of the key issues here that people might want to ask about is who supports quarantine. First group here I have is police, military and security. And I've seen a lot of people get really sort of focused on, do we use police, do we use private security? It doesn't matter, as long as they are not a transient workforce, that they can take sick leave and that they're very well trained in infection prevention and control. You need police sometimes, but a lot of the models in Australia would revolve around sort of private security firms backed up by the police if needed. You need doctors and nurses to be available, because people in hotel quarantine get sick with non-COVID related things, and they get sick with COVID. So you can't just sort of because you can't just leave your room unless it's a sort of a kind of an emergency where you call an ambulance. You need to have medical support available to these people, and you need to have mental health support available to these people. Staring at the walls for 14 days really gets to some folk, as you can imagine, and you need mental health support. We have mental health nurses, we have 24-hour telephone counselling. All that kind of stuff is really, really important, or people really struggle to comply. We have a big logistics and operations sort of centre. So each group of hotels, or each region in each city, would have a sort of a health emergency operations centre who coordinate all this stuff between doctors, police. They'll coordinate things like regular salivary testing of hotel quarantine staff. They'll give me a call if I'm on call for public health about a potential breach, of quarantine, things like that. You need people who can coordinate all this. So it's not just about police and military, which I think get a lot of the sort of the headlines. I think you need a 24-hour support team to manage these hotel quarantines, especially as your numbers get bigger. And then you need your exemption teams, and I spoke about them earlier on. So look, that was the very, very quick run through that I was asked to do. There's a huge amount of detail in what we do, and it's been a year of, it's not all been plain sailing. We've done a lot of learning, but I think at this stage we probably recognize what you need and what's important and what the priorities are. But the take-home message is it's worked really well. We don't have COVID, and look, I would give my right arm for hotel quarantine to stop. I haven't seen my family in Ireland, in nearly a year and a half. I have a new baby who hasn't met his grandparents, because we can't just leave the country and come back. It's not pleasant, but it works really well. But it has to be part of a broader suite of public health measures, and I think that's really important.